Hello, my name is Nicole Mason and I am a psychiatric PA. I'm here today to talk a little bit about bedwetting. This is probably one of the most common problems in the pediatric population. The incidence or number of folks that deal with the problem does tend to decrease with age, but you can still find up to 1% of the population over the age of 9 that still struggles with pretty frequent bedwetting. A pretty difficult statistic to digest is that if by 8 you are bedwetting more than 3 nights per week, you only have a 50% chance of stopping bedwetting completely by the time you're an adult. This is an issue that has been researched for probably 40 plus years. And to be honest, we don't have a good firm conclusion as to what is exactly going on in the brain that causes some folks to struggle with bedwetting problems. But we do know that as a direct result of bedwetting, there can be a lot of issues that happen in the home, whether it's the parents that are having to change bed sheets several nights per week, or get up with alarms, or try to keep them from wetting so they're waking their kids up, diet restrictions, fluid restrictions, or the kids themselves feeling ashamed and like they've done something wrong, or that they're a failure because they bedwetted, or they can't go to their friend's house. This is just a really big problem for a lot of families that struggle with this. It is considered to be a neurodevelopmental problem, meaning that neurologically the connection between the brain and bladder just hasn't developed in the way that it should. It also is thought to be an arousal problem. So several studies looked at bedwetters, and it was initially thought that bedwetters were really deep sleepers. But what these researchers found out was that they weren't really deep sleepers. The problem is arousal. And if you've ever had a bedwetter, you can attest to that. It seems like they're in a deep sleep because it's so hard to wake them up, but the studies just don't support that. However, their arousal threshold, or the amount of input that a parent or guardian needs to put in to get these kiddos to wake up is just much higher than other folks. There's also changes with kiddos that have bedwetting in terms of their periodic limb movements during sleep, as opposed to kids that don't. And then, as probably a result of the brain bladder signaling problem, the arousal index problem, as well as bladder capacity problems, these kiddos are just struggling. The literature has for a long time put forth recommendations for bedwetting alarms and vasopressin. There are other medicines like oxybutynin that can help with it, but by far the first line medication would be vasopressin. However, it is not the first line treatment. And the reason for that is because you can have up to a 60% failure rate with vasopressin. However, with bedwetting alarms, at about 6 months, you're going to have the same number of or same percentage as with the medication treated folks of dry nights, but over time with those bedwetting alarms, you're more likely to carry over not bedwetting as opposed to the vasopressin group, meaning that when you stop the vasopressin, most likely you're going to go back to the bedwetting or rebound to the bedwetting episodes. It is for these reasons that bedwetting alarms are the first line treatment. Bedwetting alarms do help some kiddos with their brain bladder signaling. For some kiddos that have just really high thresholds for waking up at night, bedwetting alarms aren't even enough. And so we have developed a program that encompasses all of that. We take a look at the kiddos to make sure that they don't have one of the more rare conditions like, scoliosis, or a more common condition like constipation that's really leading to the bedwetting, as opposed to what's considered primary nocturnal enuresis, or your biggest group, 80% that have that bedwetting. And then from there, we work with you to figure out the best plan to get your kiddos to a path to success. And it requires a specific program for building up those brain bladder signals, as well as parents working with you so that you can better understand what's going on and how to help your kiddo be more successful in treating the bedwetting problems. So if you're interested in learning more about bedwetting and the success that we've experienced here, please feel free to call, email, or book online. If you have any questions, you can call our phone number. It's 918-858